Namaste friends. I hope that you're all doing fine. You've enjoyed our previous videos. We've come up with a lot of videos on health topics. If not, please visit our YouTube channel. Watch them. Put your views. Share your views with us in the comment section, or you can contact us. Today we have come up with a very climate or weather relevant topic. Usually in winters we see a lot of arthritis related cases in the clinic. Otherwise also a lot of you might be experiencing, people who are going through arthritis are experiencing excessive pain, excessive stiffness as the winter is progressing. So why do you see a lot of aggravation of symptoms, especially of arthritic symptoms in winter, and what can we do to manage symptomatically as well as in terms of treating the condition? What can we do? So let us try and understand that today. So if we see in winter, winter is a weather where there's a lot of dampness, there's a lot of cold wind, and the temperature is very low, and our body tries to balance with the external temperature. It tries to maintain the body temperature. It cannot allow the body temperature to go down a lot, because the physiological functions will be hampered. So what will happen? The body will try to increase the heat so that it can bear the weather, it can bear the cold weather. So what is happening? There is already dryness because of the winter, and also there is heat aspect that is going up in the body. So inflammation will start to increase in winters. Added upon, of course, there are a lot of other lifestyle contributions also, in terms of stress, in terms of what food we eat, what are our lifestyle in terms of how we sleep, where we sleep, what clothes we wear, what food we eat, what sort of environment we are spending our entire day. Are we spending our day in an AC room? Do we expose ourselves to natural weather, sunlight? All of these are anyway contributing factors. But in winter, with this, the addition of all of these factors along with the climatic change will aggravate the inflammatory condition of the body, and especially in the joints. The two main arthritis or arthritic conditions that we see is osteoarthritis and rheumatoid arthritis. Both have their unique symptoms. I will not go into uniqueness of each of it, but we see there is pain, there is stiffness, there is a lot of burning sensation. Some people will also have swelling, warmthness in the area increases. Some people will have that it's very burning, it's very heated up, that sensation is there. There is also in rheumatoid arthritis specifically, there is sometimes it can lead to deformities. The joint will be deformed from their normal structure. So these are the main symptoms that we see, and it will lead to reduced range of motion. So the functionality of the joint will reduce. So even in terms of traditional medicine, if we see this, the dampness, the cold weather, the cold wind, all of this aggravates the inflammation by blocking the energy flow in the body. So if we as soon as the summer sets in, we'll feel a little better, because there is a little bit of freeness that happens in summer. The stagnation or the congestion of the energy will ease out as the summer sets in. So the degenerative aspect, that is mainly in osteoarthritis, that is the aging. Degeneration means the changes happening in the joints, in the ligaments, in the fluid or the lubrication that is in between the bones. All of these, as we age, there is some amount of change that happens, wear and tear happens, right? It's same like a cloth. The cloth that we wear, after some years there is some amount of wear and tear that's happening. The same thing happen even in the joints as well. So the degenerative process along with the increased inflammatory process aggravates these symptoms in winter. Okay. So what do we do in acupuncture? In acupuncture, what we do is we choose points to insert the needles by two basic concepts. The one is, of course, the energy balance that we have discussed, how acupuncture brings about energy balance in the body. So certain specific points are used so that the stagnation or that congestion of the energy that is happening is relieved. And at the same time, certain local points where the pain is more, we use certain points there so that the neurochemical effect of the acupuncture is there. Certain pain, the natural painkillers of the body, what we call as, is released at the area of the point or the needle insertion, and that is, these are the main two concepts based on which we choose points for arthritis. So with around say 12 to 14 sessions of acupuncture, you will start seeing changes in terms of your movement improves, the stiffness will start to come down, the swelling will gradually come down, the symptoms of burning, the warmth, they will start to reduce. So these symptoms are coming down means that the inflammation is coming down. Right? So with what we are trying to do, we are going to educate you on what lifestyle modifications you have to make, how you balance your body with the help of the food that you eat, with the weather, with your lifestyle, with, of course, now the vitamin D concept also is very prominent because we lack sun exposure. So with this health education in one side, with the modifications in your lifestyle, we have the supportive treatment of acupuncture that will help at that point of time to basically reduce the inflammation as well as increase the functionality as well as balance the energy, right? So all of these three things are happening at the same time. So modification, treatment, energy balance. With this, once you are set right, once you are seeing improvements in your functionality, we bring yoga therapy into picture. That will add on to, or that will basically supplement the entire process for your long-term benefits. Okay, so that is how acupuncture is going to help you in management, in treatment, as well as rehabilitation of your arthritis. If for example, if your arthritis is very chronic, if not early detected, if it's very chronic, then we'll be able to rehabilitate. If it is early detection, then we'll be able to prevent further complications, help in management, also delay surgery many times, and that is how we are going to in a comprehensive way help you with your management of arthritis. I'm sure that you have received the information that you are seeking for. If you are going through pain, especially because of arthritis, be it degenerative or inflammatory, please do visit our clinic, understand how we work for with acupuncture for arthritis, and I hope that you will be benefited out of it. Thank you very much. Please do watch more videos and share your views. Thank you.